I'm Dr. Samuel Lin. I'm board certified in both plastic surgery and otolaryngology, head and neck surgery. And I'm here to talk to you about nasal surgery or nose surgery, both from a functional standpoint as well as an aesthetic standpoint. So the nasal septum is a partition that divides the left and right sides of the nose on the inside of the nose. Many times that septum can be deviated, meaning crooked to one or both sides of the nose, and causing nasal obstruction or being not to be able to breathe through the nose as well. However, even with a deviated septum, many people go on with their lives and just fine until one day either one of three things happens. One, they get bumped in the nose. Two, they have a nasal surgery that changes the dynamic of the inside of the nose in terms of physiology and they can't breathe as well. Or thirdly, they just, as the process of growing up, the nasal cartilages can become more deviated and they suddenly notice that they can't breathe through their nose, either on one or on both sides. So a procedure to help with correction of and helping people breathe better involves something called a septoplasty, which is a trip to the hospital, an inside incision that's made on the inside of the nose where the deviated or crooked parts of the bone and cartilage are straightened or removed. There are turbinates, which are areas of tissue that help warm and humidify the air that we move off to the side just to create more space inside the nose. And oftentimes, if a nasal valve issue where there's a narrowing of the nasal valve inside the nose, I place a piece of cartilage take a piece of cartilage from the septum and move it up to the valve area to help, again, open the nasal passageway up for breathing. It's sort of like an inside internal breathe-right strip. Afterwards, there's a splint that's placed on both sides of the nose on the inside, and that's in place for about 1 to 2 weeks' time. That helps prevent any webbing or scarring from forming across the inside of the nose. And afterwards, people heal. It's a day procedure. It's really tough. I tell people that first week, you may not be able to breathe out of either side of your nose initially because of swelling and drainage. But after the first week and the second week, once the splints come out, people feel a lot better in terms of breathing. There might be a time where people have a little temporary tooth numbness in the front that goes away. There's a rare risk of a little opening called a septal perforation, which communicates the two sides of the nose on the inside of the septum, which doesn't develop very often. Even when it does develop, oftentimes people don't have symptoms from this. Besides the usual considerations or risks of any procedures, including bleeding and infection. And that is components of the functional parts of the nose in terms of a procedure. I also tell people aftercare using some saline spray and aiming out to irrigate the nose 3 to 4 times a day. People shouldn't blow their nose afterwards for a time, and also open the mouth if they have to sneeze, just to take off pressure in the area in terms of having a nasal procedure. Now, in terms of the outside part of the nose, or cosmetic or aesthetic rhinoplasty, or shaping the nose differently, the nose on the outside is made up of bone and cartilage. And really in terms of honing and thinking about how to approach the nose on the outside, nothing that is done cosmetically should impact the function of the nose, and conversely, nothing functional should impact the aesthetics or the way the nose appears. And so different people have different goals in terms of whether it be shaping the bridge of the nose to have less of a sort of a bump on the bridge of the nose, to decreasing the size of the lower half of the nose in terms of the nasal tip, to narrowing the nose. And it really is individual, and I encourage people to really think about what they're actually considering in terms of their goals, their sort of first 1, 2, 3 goals of what they would like to accomplish in terms of their nose, in terms of an aesthetic rhinoplasty. Everything also has to be in balance, and so it's hard to do one thing and not change something else, and so it's important to kind of have everything also be in balance in terms of the nose as well, in terms of an aesthetic rhinoplasty. Swelling takes about a year to go down, most frequently and most prominently in the first 6 to 8 weeks, and more gradually over the course of a year. Historically, 15 to 20% of the time, after a year after swelling, people see other things and decide to have other things in terms of their nose, in terms of touch-up procedures or revision procedures. These are things that are typically not large or complicated procedures usually that involve touch-up areas that they see or didn't see prior to a surgery. So it's important to realize that at a certain percent of the time, people may have other additional procedures. And otherwise, there are two options for rhinoplasty. One is sort of an inside, what's called a closed approach rhinoplasty, where there are only inside incisions are made. There's also something called an open rhinoplasty approach, which essentially involves an incision underneath the tip of the nose in this area, where the skin is then used and lifted to make the most accurate changes to the underlying cartilage and structure of the nose. And so rhinoplasty, both from an aesthetic and functional component, is a very individualized procedure. Each person is very different, and it's very important to consider those aspects that are unique to each and every patient. So thanks for your attention. I hope this has been helpful.